According to WHO data, non-communicable diseases are the leading cause of death around the world, amid efforts to build global health capacity to tackle the scourge of NCDs. Here, health practitioners are being trained to provide adequate NCD care alongside detection capacity. The Assistant Director of Health Services at the Ministry of Health, Dr. Fatoumata Diba, underscored the importance of the training in providing evidence-based interventions.
The survey aims to establish prevalence of NCD risk factors in the Gambia across the general population. When these risk factors are identified, it will guide the Ministry of Health in better planning, implementation, and resource mobilization to reduce the burden and complications of NCDs in the country. The last time such a survey was conducted was about a decade ago, and for this, the reference is no longer, we feel that the reference maybe is obsolete.
Dr. Desta Chireni highlighted some of the risk factors causing non-communicable diseases and statistics involved in increasing deaths among people under 70 years of age.
It's a common knowledge that the world's biggest public health challenge today is the increasing burden of NCDs, mainly heart diseases, stroke, cancer, chronic lung diseases, and diabetes, which together, cause about 74% of the global deaths. It's also common knowledge that these diseases are fueled by 4 main risk factors: tobacco use, physical inactivity, which is very, very rampant in urban centers. Unhealthy diet is also another issue. We have to mind what we eat, and this is also another factor. Alcohol use, also inappropriate use of alcohol, meaning harmful use of alcohol. I think indoor air pollution also, arising from the use of solid fuel, is also another risk factor. So we congratulate the Gambia on initiating the second round of the WHO stepwise survey.
Speaking on behalf of the Health Minister, Permanent Secretary Muhammadu Lamin Jaite reflected on the 2013 survey which guided the ministry in its policy intervention, explaining the need to undertake a new proactive survey for efficiency in addressing NCD's risk factors.
What we knew in 2010, when the first WHO STEP survey was conducted in the Gambia with the support of the WHO organization, was that 15.6% of our adults aged 25 to 64 smoked tobacco. 22.6% were not physically active. 1.2% drank alcohol. That adults aged 20 years and above consume about 8 grams of salt per day, exceeding the WHO recommended threshold of less than 5 grams per day. Our socio-economic demographic profile has changed over the years, resulting in changes in our lifestyles and context. Therefore, ladies and gentlemen, conducting another round of stepwise survey this year is a step in the right direction.
The 5-day training of data collectors prior to the upcoming national survey on NCD risk factors brought together more than 100 participants from different parts of the country in a major effort expected to enhance their efficiency and effectiveness in conducting the national survey. Khadijatu Jallow, reporting for GRTS News.